Sure, a few more will trickle in as we get started. So, welcome everybody. I'm April Harrington, the project manager of the Chicagoland Healthcare Workforce Collaborative. Thank you for joining us today for Strengthening Student Success and Workforce Pipelines, a partnership spotlight on Northwestern Medicine and Clasp. For anyone who is new to the Chicagoland Healthcare Workforce Collaborative, we are a group of employers and industry partners in the Chicagoland area who have united to support a more inclusive, stronger, more equitable healthcare workforce in our region. So we do that by opening doors for more people to enter careers in health, by bridging the gap between our education providers and our employers to revolutionize the way that we think about talent pipelines, which is something we're talking about today. And we talk a lot about how we might make sure that people who enter careers in healthcare have access to opportunities to advance and earn higher wages and build wealth building careers. We're an employer-led sector partnership, so we are led by some of the employers that you see on this screen. Um, and many of you are here today. Thank you for joining us. But we also welcome all of our strategic partners, including our educators, our community colleges and other training providers, our workforce development organizations, funders, advocates, and everyone who is invested in a stronger healthcare workforce in Chicago. Um, I am recording today's session, as I mentioned, and I will send the recording and the slides to you all, everyone who has registered today. I will also put it up on our website. I'll drop our website in the chat where you can see our past events. You can always find past recordings there. You can see future events. And if you aren't already getting our monthly newsletter, you can subscribe to our monthly newsletter on our website. So as I said, today we are focusing on a fantastic partnership between CLASP and Northwestern Medicine. So I'm happy to pass it over to Tess Michaels, the founder and CEO of CLASP. I've known Tess for over a year now, and it's
Yeah.
been fantastic to see the how this organization has grown, and fantastic to hear from Erin how it's been so impactful to help Northwestern access and build relationships with students in these hard to fill roles. So with that, I'm going to stop sharing.
Perfect.
And I believe Nikki has permission to share. Let me know if there I'm allowing. And I'll pass it over to Tess. Take it away.
Hey, wonderful. Thank you all again so much for joining. And April's exactly right. We have loved working with Erin and team. Also, half the battle is finding partners who are just really great homes for individuals to join and stay and feel really included. So before we kick off with intros and the rest, I wanted first to pass the mic to Erin just to share a little bit about her background, where you spend your time at Northwestern, Erin, and then I'll follow.
Yeah, absolutely. My name is Erin Cohan. I'm Director of Talent Acquisition at Northwestern Medicine. This summer will be 13 years. So me and my team, it's not the traditional transactional recruitment. We support campus recruitment, our paid summer internships, work with our Community Health Institute and Mandy Polonsky on joint ventures with workforce development and apprenticeships. So support the entire health system of trying to think creative about how we can manage these critical roles where we have a lack of talent. So great to be here. Tess.
Wonderful. And then again, I'm Tess Michaels. I founded Clasp about 8 years ago, and I'm based right in Chicago. And all we do is healthcare. Within healthcare, we're in every subvertical, so and fully across the nation. So we work with players like, of course, Northwestern, as well as like Boston Children's, Trinity Health, Novant, etc., across a broad range of clinical roles. Today, we're going to go deep on respiratory therapy and nurse anesthesia as the two that we started with Northwestern. And the goal, more than anything, is to figure out how do we just grow the pie of people pursuing really critical roles in healthcare. How do we help increase access to these roles and connect employers to students while they're in school and show these individuals that they can get an early commitment to a job and a significant amount of their student loans repaid as they're retained. And ultimately, what we all want is to just make sure that healthcare doesn't, just reduce the barriers around coming into the field, but creates the right incentives to stay in the field. So we'll go deep on that. But before we do, we wanted to just quickly hear a bit from those who attended today's conversation to understand what is the most creative thing your organization has done to source clinical talent. And for the schools or associations in attendance, add in like what have you done from an enrollment perspective? Like what have you done to just capture the hearts and minds of the individuals you're focused on? So you can put it in the chat, um, and we'll take a peek at what people say. You know, if folks are feeling shy, maybe we'll cold call Mandy on some of the cool things you've done in the community at Northwestern as an example, but um, otherwise we'll give it just another 30 seconds. Okay, well, you win some, you lose some. Today's gonna be one of those days we're gonna focus on hearing about what Northwestern has done to creatively recruit talent. Oh, as soon as I said it, folks were coming in. I think people were typing. All right. I see, at CLC, we've worked with industry partners to develop youth apprenticeships as a way to create pathways and co-develop talent. Erin, how much does your team support on the apprenticeship side?
Yes, we do apprenticeships. So, Stephanie, I know we've worked with you for a couple years, more than that. Really great partner to us.
Hmm. I see another on, a organization that works hard to tell stories of job seekers who support to let other immigrants know there's a pathway for them. What about on the international side? Erin, anything there?
Um, we have sponsored visas in the past. So it is something we've looked into. I'm not 100% sure if we have anything active right now.
Okay. Yeah, obviously a little more challenging in the current macro. Awesome. Well, if we switch to the next slide, we'll take you through a quick peek at what we do on the clasp side and then zoom back out to the macro. So a lot of what today's conversation is really focused on saying, on our side of the house, how do we, in some ways, replicate almost like what ROTC has done with the military, but for healthcare? When I say that, what I mean is like, how do you create a movement where there's a bridge between education to employment, where every dollar employers are spending is a commitment while someone's in school, but spent once someone is actually employed and paid over time as they're retained. We've seen across the country just tremendous impacts, frankly, on turnover. So for many of you who are on the healthcare system side of the house, you've probably seen that a lot of these clinical roles have, double-digit turnover, oftentimes upward of 20%. Across our partners, we have seen our turnover come down to mid-single digit. And the reason that's so important is because so much time in healthcare is wasted on just rehiring for the same roles that had just been filled, over the last couple years. And then the second piece that we really care about, and I think Erin will continue to measure together, is just the continued improvements on graduation rates when individuals can get early commitments from employers. So especially in some of these programs in respiratory therapy where there is not always, a 100% persistence through the program, what's the impact of having an employer as a motivator to get through school, get through those licensure exams, and really get to that outcome? So again, areas that gets us very excited. So with that, let's take a whole step back and get into the macro. What is happening in this wonderful, wonky world? So today's conversation is going to focus on a few things. One, the fact that we are looking at a different generation from a recruitment perspective. They've done studies and they show, I mean, this is nearly 100%. It's 96% of employers struggle to engage Gen Z talent. Second, there are meaningful school deserts across the country for clinical roles. And if we take respiratory therapy as an example, the AARC had actually shared that 40% of the enrollment seats for respiratory therapy are actually open seats. So 40% of those enrollments are not happening either due to lack of awareness of the role or due to teacher shortages or due to clinical rotation placement challenges. But regardless, that means all of the healthcare employers are fighting for 60% of the talent. Third, we have real degree inflation in healthcare. So, nurse anesthesia, for example, used to be a master's degree. It's now a doctorate degree. So, that is code for it takes longer to get through school and it costs more money. And lastly, we saw, especially during COVID, a lot of individuals, especially for frontline roles, leaving the industry entirely. So, you take the combination of this, which is less talent to fight for, the talent that's there takes longer to graduate, and people leaving the industry. And ultimately, it just means we need way smarter recruitment strategies. So, okay, let's dive in. So, for anyone who is curious, I know there's a whole suite of clinical roles that individuals are focused on or that schools train for. We support a pretty wide range from respiratory therapy and rad techs to PTs and OTs to nurse anesthesia and nurses. Um, but what we really look at is this conversation is really for employers in the Midwest. And so we figure out where are there school deserts in the country, and for what roles are we really focused on. And so again, part of the goal here is to make sure that you have a proactive strategy and that schools are continuing to meet the demand that the patient populations and the employer workforce needs for each of these. So feel free to scan the School Deserts white paper just to get a peek at all that's happening there. Okay. Um, Erin, just curious, as you thought about these specific roles with nurse anesthesia and respiratory therapy, how has your team seen just the local volume of individuals in the market versus the need to either, expand beyond or get creative on those channels?
So, in terms of the volume, I think we're seeing, with partnering with Clasp, we're seeing, an increase of the RT. I would say it's a mix of both local students as well as we're seeing students from, all across the United States. And then for CRNAs, same, seeing applicants from all over the United States.
Totally. I mean, I also think it's interesting when we look at migration patterns to figure out which roles will people really get up and move for versus others, right? So nurse anesthesia definitely probably has more mobility as we think about doctorate level roles versus associate's or bachelor's degree roles as well. So it's a great point. Okay, if we go to the next slide, we also wanted to just take a moment to talk through some of the federal policy changes. I know we saw a lot of different schools that are in attendance. So this is probably hitting home for a number of you as we think about what's happening come this July. But just for a little bit of context, the One Big Beautiful Bill has officially eliminated Graduate Plus loans. So historically, critical roles like nurse anesthesia, physical therapy, occupational therapy, nurse practitioners, physician's assistants, mental health therapists, we could keep going. All of these roles used to be able to get unlimited federal student loans to get through school. Now that is capped at $20,500 per year, and that covers anything you need to borrow for school. So tuition, housing, books, um, which obviously is a lot less than the annual cost for many of the schools in the US. So that effect goes in place this July. And so again, it is a pretty meaningful impact as we think about who enters healthcare and those that may not have access to a private loan because they don't have a cosigner, which is code for wealthy parent. So again, it has real ripple effects on how we think about the future workforce pipeline, and all the more important, for organizations like Aaron yours to give them some peace of mind about the bets that they are taking. Um, just curious, Aaron, has your team spent time digging into just these policy changes, what it'll do, especially for the local schools in the area? If so, how? If not, we can keep moving.
We haven't. There is a team that, does look at it, but it isn't something me personally and TA have dug into very deep at this time.
Yeah. Frankly, it's a lot to unpack. The One Big Beautiful Bill had a lot of pieces in it, and it's just a question of where you focus. But I think the biggest piece here is just making sure that individuals have optionality on figuring out what are all of the possible private loans they can use to gap fill that education so that they can get through it. And if those private loans are more expensive, having the confidence to know that maybe having an employer help repay it will not hurt as much on the back end. Um, the last impact that is worth noting, I know many of you are nonprofit hospitals. If the amount someone can borrow in federal loans comes down, it also means the amount that's eligible for public student loan forgiveness also is reduced. And I speak from a personal perspective, but my husband's a surgeon over at Loyola, and he only looked at nonprofit hospitals to start his career because he had a lot in student debt and really wanted to work towards his public student loan forgiveness. And he told me, he's like, look, the bulk of my loans are federal, but I don't know if that decision would have changed if half my loans or more than half my loans were private. And the impact to me had come down greatly because of this. So again, those are some of the call it healthcare system related impacts that sometimes go a little unnoticed. So anything else, April, you'd like to add? I know you're at the coalition of the school side meets the employer side, and this is obviously one of those policies that bridges the two.
Yes, and I was just writing in the chat that at Chicagoland Healthcare Workforce Collaborative, we are going to devote our June quarterly meeting to federal policy changes and unpacking them and understanding how they're going to affect the healthcare workforce in Chicago. And one of the things that I've been digging into are these changes to graduate student loans, also the introduction of workforce Pell Grants. But the changes to, the nursing graduate school loans is going to have an impact down the line for the nursing pathway, because we know that faculty shortage is a big issue that impacts our nursing shortage. Nursing faculty need to have master's degrees. If we have less nurses getting master's degrees, that means less faculty to teach our associate's degree RNs or our LPNs and our bachelor's nurses. So it'll trickle down, and I encourage everyone to come to our June quarterly meeting to unpack this some more. And partnering with Clasp is one way to get ahead of this and help mitigate the impacts it's going to have on our workforce.
Really. Well, now we're going to do one last macro change and then get right into all the work Northwestern is doing. So if we go to the next slide, we're really getting into the state side of the house. So this is actually very recent. And the reason it's important to flag it here is because obviously, Illinois may see this impact happen if you're seeing it impact other states. But as of this January, California actually banned clawbacks as a key mechanism. Now, if we think about what the different tools are that employers oftentimes use to recruit talent, sign-on bonuses are one of the primary tools. Oftentimes, the way a sign-on bonus is structured is they pay a big chunk up front and they put a work commitment in there and they say you have to stay for X amount of time or we're going to chase you down and claw back those dollars. Well, that is now a structure that a number of states are not allowing to exist. And they're called different names, but it's the same impact, right? Stay or pay in California, The state of New York is finalizing their policy change there. It's called the Trapped at Work Act. Um, and so again, just an interesting moment for us as we think about tools that are paid over time as individuals stay, are retention based instead of tools where you have to pay upfront and then again chase people down. Because from a legislative perspective, that may become something that, Illinois, in short order also cannot service. Um, Aaron, I don't know if your team has any views on this. I know you have sign-on bonuses as one of the key tools in your kit. And obviously, as of today, it is okay for Illinois, but the question is, will that change? Any reactions there?
I mean, I would say with like sign-on bonuses, retention bonuses, I think, you know, we've learned over time that if we are going to have them, we need to make sure that we are doing it over a longer period of time. So, even looking at paying things on the first paycheck, it's very, very rare that we would do
Yep.
that because of those reasons.
Yeah. Perfect. I agree. Everything should be tied to the actual goal, which is people staying, not just joining. Awesome. Well, let's get right into the work that we're doing together. So, Aaron, I will pass the mic to you on how did this all come together, and then we can get into what some of the channels and results have looked like.
Yeah, thanks, Tess. So I always like to start off with the why. I think a lot of my healthcare partners that are on this call can kind of feel the pain. It's not just a Northwestern medicine kind of challenge, but we have been facing challenges for many years for critical clinical roles such as like nursing, imaging, rehab, so PTOT, CRNAs, respiratory therapists, just name a few. So kind of looking at what are our different solutions. So working with an TA, working with our community health institute, working with our academy, with our leaders, trying to kind of map out what is our strategic plan to get talent to come to Northwestern. So two roles really stood out, CRNAs and respiratory therapists because there's a national shortage, and two, there's not a lot of local graduates that, we have in our pockets. So then we start fighting over the same talent, giving sign-on bonuses, higher pay. So we really wanted to double down on those two roles, at least to start. So we looked at, okay, what do we have internally that we can do to entice people to come? We looked at and interviewed different vendors, like who would be, if we're going to do this outside of NM, who would be the right vendor to partner with. So in October of 2024, we partnered with Clasp to help engage students that were still in school and hopefully secure a commitment to come to NM post-graduation. Next slide. So the purpose of the partnership is just that, is to secure this talent early on, before they graduate. And a couple of exercises that we did, obviously you're always looking for a return on investment and does this make sense? So we looked at, how much does it cost to recruit? How much are we paying for sign-on bonuses? What does the turnover look like? What does our contract labor costs look like? And really doing a cost analysis to make it make sense. We want to make sure we're partnering and moving forward with different programs and projects that we will see a return on investment, even if it's not immediate, if it's over time, by bringing the talent in and then having them stay with us reduces the need to use agency long term, reduces the need to have these retention bonuses potentially in play to keep people at NM. Also, what we really liked about how this was administered is that we lock them down while they're in school, and then we don't start paying until they actually start at NM. And it's drawn out over the retention period. So let's say it's a 3-year retention period. Each month it's prorated. So if the individual does leave, say after a year or two, we stop paying immediately. And really, the strategic benefit of this partnership is building that pipeline of talent, enhancing talent retention, also showing our employees that we care. We care about their finances, and then creating cost-effective staffing solutions. Next slide. All right. Another reason why we partnered, I think anyone on this call can understand TA is extremely, extremely lean, especially in healthcare. So I have a small but mighty campus recruitment team. We can't be anywhere and everywhere. So what was nice with this partnership is that they have a team that actually goes out there, markets this program, markets NM. I know I've been to California before. The purple, people don't know the purple necessarily out in California or on the East Coast. By them going out and representing NM, our brand is getting out there in places that, wouldn't necessarily be out there without this program. Also, too, marketing is a big piece of this. So, yeah, we have Instagram pages, we have Facebook, we have LinkedIn. A lot of it is run by our marketing department. I can tell you with having your own TA team, you actually need somebody to run it, somebody to think of the content, think of all these things, ways to engage with students. So what's nice is that they have influencers that are out there on TikTok, Instagram, talking about this opportunity, really engaging with individuals so that they know about this. So that's on top of going out there to different, events for CRNAs and RTs. And so by doing that, we've seen applicants from across the United States apply to be considered for this opportunity. Next step. All right, so what are our results today? So as mentioned previously, in October of 2024, we signed an agreement to move forward with this partnership. So there's a lot of things that have to happen once you sign that contract. You have to get the marketing material put together, get marketing to approve, have a plan in place so that their team can kind of run with it. So it has been a short-term partnership, but we've seen some great results. So last year, the program officially launched. We had 16 CRNA applicants from 10 states. And then 23 RT applicants from 9 states. One thing I want to say with like the way that we staggered it, we did start with CRNAs. And then a few months later, we started really focusing on the RT recruitment. And then as of today, we have 19 CRNA applicants. We have 7 CRNAs that have been placed or accepted the offer to come to NM post graduation. 5 of them are actively employed at NM as of today. And then the team has 8 candidates that they're considering that are in review. One thing I do want to note about the CRNA team, they are using this as part of their recruitment toolkit. So if there is an applicant that does apply that they think is a great candidate, they're a new grad, they will tell them to go ahead and apply to Clasp. So it is another carrot that we can use to secure talent, even if they organically apply to Northwestern. And so we do have a plethora of RT applicants. I know that the team is moving forward with reviewing, and then we have 5 RTs that are placed that will be starting this summer. So lots of great accomplishments that have happened in a short period of time. And also too, just to note with some of the applicants, we are deferring them. So for RT and CRNAs, they do like to see them like about a year before they graduate. And that's where they feel like they feel confident kind of talking and interviewing about what they've learned, what they are looking to do post graduation. So what's nice too is based on feedback, they actually created in their portal a place instead of just declining them where we could defer those applicants so that when they're a little bit closer to graduation, we can revisit and have conversations. So I'm going to pause there. Does anyone have any questions?
I think there's one in the chat from Bridget about how this differs from your previous applicant flow and hiring process and retention, or maybe
Yeah.
that's a separate question about retention and how that's working.
So retention, it's still a little bit too early to talk about retention. I can talk about applicant flow confidently. So I should have mentioned this too. So CRNAs, we piloted system wide. For RTs, we piloted it at our downtown campus, so NMH. So it is not system wide. I can tell you with confidence, We do not have 32 applicants at a time prior to CLASP. It was kind of would trickle in, here and there when it comes to RT. CRNAs, you know, yes, we're seeing an increase, but we're definitely seeing the benefits on the RT side, which I think anyone on this call that is in healthcare recruitment, that's phenomenal in terms of volume.
Any other questions? Because I can give a couple more details. Okay. All right. So first of all, thank you, Erin. Just
Of course.
a few details worth noting. So the way we've always thought about this is exactly like Erin said. It has to be a partnership, right? So we're working like in lockstep with the recruiting team, so nothing's duplicative. So like exactly like you said, you have your own internal Instagram page or Facebook page, but we work with TikTok influencers that are separate from the organization and they are micro influencers who maybe are SRNAs in school or RTs in school, have 20 or 30,000 followers, or mega influencers who are like practicing CRNAs or RTs and have a couple 100,000 followers. But they can spread the word, build awareness about the brand, and then the links go to landing pages that are NM branded and look and feel like you all to actually drive those apps. And so again, it's meant to complement the efforts, not to just replace it and be like, and we created another NM Instagram page. That's not the point. Same thing with the events. Like we want to know your content calendar, ours, etc. Um, Last thing on the retention side. So this is part of what gets us excited about this partnership now, because Erin, your team will get to see a lot of those results. Of course, the dollars and cents are only paid as individuals are actually retained. And so inherently, there's not dollars at risk unless you're seeing the results on reduced turnover. But on top of that, we do a lot to gamify retention. It is like a big part of our philosophy, which is that people have short-term memories and that the dollars and cents alone are not going to get you the results. It has to be a psychology that you build. And so every single month, we send individuals a bill that says, this is what you would have owed had Northwestern Medicine not had your back. It would have taken you 10 years to pay down this loan. Now it's taken you 3 years. We gamify that with thermometers. We also collect video testimonials, as Erin has seen. We actually do that every year they're employed. So you continue to see that loyalty build over time. And they get access to financial wellness tools. And that includes, for example, budgeting tools that say, hint, hint, you got more in your budget now because of Northwestern Medicine. So again, they have to almost see the impact, say the impact out loud, and then like see that the maths in a lot of ways. And the beauty of that is for our partners across the country, our turnover is single digit across our roles, which if you think about most clinical turnover, right, you obviously typically are closer to that 20% pre-clasp. So again, something that we are excited about. And, our hope is to continue to get feedback, Erin, from your team, even like the future pipelining status, right? Like to continue to get ideas so that it just keeps getting stronger together. But anyway, it's just been so fun working with you all. So yeah. Any other
Amazing.
question? Yeah, go ahead. Were you going to chime in, Erin?
No, I was just going to say amazing.
All right. We'll give it just a minute because last time when I tried to not give enough time for people to type, answers came later. But I know we had a few new joiners come in a little bit into the conversation. So for those of you that joined late, anything else that we can cover? We kind of kicked off with some of the macro changes before this.
Well, I'll chime in. I'd love to hear more about the financial wellness tools that you mentioned, Tess.
Yeah.
And I know you talked a little bit about, how you continue to message to the students once they've finished their program and they've been hired into the health system that, you know, here's what you would have had to pay that your employer is now paying for you to instill, to illustrate that investment that they've made. Are there other tools or are there other ways that you are really driving those really strong retention numbers that you're seeing?
Yeah, great question. Okay, so the way that we typically work is first, while individuals are in school, as soon as they get accepted into the program, they get access to the full suite of wellness tools. So that'll include study tips while they're in school. They'll start getting access to those budgeting tools. With a lot of our employers, we set up meet and greets and things like that just to start building that community. And then once they're employed, there are additional tools like how to work well in a team, how to have good EQ, things that are some of the soft skills that frankly like help, especially for new grads onboarding into the work environment. And then from a pure financial perspective, we also especially given so many of our partners are nonprofits, have guidance tools around public student loan forgiveness that we've partnered with like multi-billion-dollar nonprofits on just to make sure everything's buttoned up and tight. But the goal there is just to make sure that the way we help facilitate the loan repayment has both federal and private loan access. So we have no bias. We're totally loan neutral. But the repayments are done in accordance with the rules to stay eligible for PSLF. So we want to make sure that like everything's working in sync, and that these individuals will hopefully stay with NM for 10 years and not only get their near-term immediate debt, chipped away at, but then get, that longer term, outsized pieces helped as well. So, yeah.
It's fantastic. And it's great to see that, Northwestern is attracting talent from elsewhere. Our collaborative did a deep dive on the respiratory therapy workforce shortage last year. And we know that, with all of the great collaborative work that our community colleges in Cook County and the Collier counties and all of our, hospitals are doing, we still, do not have enough respiratory therapists coming out of our programs each year. But we do have a lot of representatives on the call that are from our local community colleges and other colleges, universities. I'm wondering if you could say more about how they might be able to introduce these opportunities to their students, or, are there additional employers besides Northwestern that you're already partnering with in this region?
Yeah, yeah, we have multiple partners in the Midwest that we support for a number of allied health roles, including respiratory therapy, but also rad techs and surge techs and other roles there. But what I would emphasize there is, look, our goal is just to make sure that the that when there are school deserts, that is where we're helping widen, but that we're also optimizing locally, right? I mean, the highest probability that someone will stay with Northwestern for many, many years is it someone who happens to be from this region, loves this city, like has built their home here, has their extended family and immediate family here, etc. And so like that, is the North Star is like, let's make sure that we can make our local community as like optimized and perfectly populated as it can be, because it hurts that the enrollment seats for respiratory therapy are not fully filled for a lot of schools. Like that is an area that collectively, I think, we'd love to figure out, which is like, how do we make taking the leap of faith easier? And how do we incentivize and motivate people to get through graduation? And how do we make sure clinical placements are aligned, right? So, Erin, I'm sure you have a thought there.
Yeah, I was going to say with any of the colleges on there, on this call, if you're interested in receiving the flyers, just email me and I'm happy to send out the marketing materials so you can take a look at it and share it with your faculty or students that might be of interest.
Yes. I will put both of our emails in the chat just so folks have it. But yeah, again, that's really the goal here, and that's why I think April, what you all are doing is so important because it's like making all of the different parts of the system talk and being in the same room. And I will say that RT event that you had was, I thought, really rare because I don't always go to events where you get schools and the employers and the students and the associations all in one setting together. A lot of times we have to go to each of those events separately to meet with each, group. And so it was awesome. Yeah. Right.
Did we have another slide or two? I thought there
There's
was.
All
another slide with Alan. Yes.
right. Yes, thank you. Um, Aaron, you want to talk through just like briefly his experience? Because I think he's officially started, correct?
Yes. So Alan started at NM in October of 2025. That is at least 6 months to a year prior to graduation. So Alan is giving his testimony on, why he wanted to move forward with the offer and what the additional financial support means to him. So hand it over to you guys to play.
Ultimately, it's not just about the financial relief, it's about the peace of mind that comes with it, with the ability to move forward with confidence and purpose. What excites me the most about the loan repayment program is the freedom it offers, both personally and professionally. As a healthcare provider, I've invested years into my education and training, and while it's been incredibly rewarding, the financial burden of student loans has always been a heavy weight. This program lifts that weight for me. It opens up opportunities to focus on my passion, providing exceptional care without constantly worrying about the long-term impact of debt. It also gives me the flexibility to make life decisions, such as investing and saving for a home, much sooner than I thought possible. Ultimately, it's not just about the financial relief, it's about the peace of mind that comes with it, with the ability to move forward with confidence and purpose. Without this loan repayment program, my journey would have looked a lot different, definitely more financially constrained and more stressful. I would have had to make career decisions based more on salary rather than passion or purpose. Things like working extra shifts or delaying major life goals such as traveling or buying a home would have been necessary trade-offs. The constant presence of student loans would have added extra pressure, especially early in my career when I'm still trying to find my footing as a new graduate nurse anesthetist. This program has helped me shift my focus from just getting by to being able to build the life and career that I envisioned when I first started school. I would tell future students to absolutely apply for this, especially as a new graduate nurse anesthetist going into Northwestern and/or Clasp. If you're even considering applying to a program like this, it means that you're already thinking about your future with purpose. Programs such as this and Northwestern Medicine aren't just about financial support. It's about creating space for you to grow, to serve, and to focus on becoming the best version of yourself, whether that's in the operating room or at home. Even though the application process is daunting, and even though school takes a lot of work, it comes with that peace of mind at the end, especially with the flexibility that you get once you become a full-fledged nurse anesthetist. That makes going through anesthesia school, applying to Clasp, and Northwestern worth it. Don't let fear or uncertainty hold you back. If this program is a fit, it can completely change your trajectory in the best possible way.
Awesome. Well, I hope he's been a great fit so far, Aaron, for the team. But that was really how we wanted to end it. So we're going to open it up for Q&A and then just share our profiles if anyone wants to connect after this. But we'll be here to answer any questions, and then our emails are in the chat for folks who want to connect after.
And we're a small enough group here, so feel free to just come off mute, share a question, a reflection. Are you doing anything like this at your systems? What did you find interesting about this partnership and this platform, this way of recruiting talent? Anything that you thought was great, exciting? Anyone share?
Hey girl, it's Shonda here.
Thanks, Shonda.
So I'm from Loyola Medicine. So I'll share because I think the reality of life is that student loans is really what holds young adults back from, to the gentleman's point in his video, from like the things they really want to do. And so, I mean, I totally like love the concept. Like, I think it's like definitely like next level thinking outside the box. So, Tess creating this, her company is, I mean, I think like again, next level, because that's one of the things that really prohibits individuals from considering some careers first because of the amount of debt that they will be in when they're done. And again, just starting in the field, exploring again, traveling to different places to even like choose a job for a person that goes to school in one place and is able to work in an amazing city like Chicagoland, right? Um, and I just think it's great. I mean, I just kudos to NM for again being one of the first in the Chicagoland to have this partnership, because I definitely see the value in it. It's something I tell my own son, you know, and the students that communicate with from a workforce development perspective, because at the end of the day, being able to again buy a property, start a family, take care of your kids, pay for daycare, you know, having an employer that's willing to help you offset those expenses so you can do the things that are more important to you, I think is just extremely valuable. So I love the concept. I love what Clasp brings to the industry of healthcare to again help those interested in um, pursuing healthcare careers and degrees that are costly again, you know, be productive and work for great employers that's willing to help them, you know, pay for those expenses. So thank you so much, Tess. This is just awesome. And thank you, NM, for being a pioneer here for us.
Of course, thank you. And one thing about these two, so with RT and CRNAs, it is virtually impossible to work even part-time while you're in these programs and take advantage of your employer's benefits and tuition reimbursement. So this is just a great complement to that, is focus on school, be your best student that you can be, and then, if an employer can help offset those costs post-graduation, that's a win.
Okay. Well, I know we're coming up on time. April, if you just, or Nikki, if you just go to the next slide. This is just to connect with either of us, but Erin, this was really fun doing this together. And thank you, April, for organizing.
Yes, thank you. Thank you all.
Thank you both for taking the time to present on this partnership. I'm sure we'll all be curious to see where it goes from here. To everyone on the call who's with a hospital system, I encourage you to share the recording and the slides, with your folks in talent acquisition, specifically your nurse recruiters, to see if it's something that they would like to explore. Um, and, as always, feel free to reach out to me with questions or to get connected with Tess. If you remember this 3 months down the line, what was that? I'm always here to be a connector. So thank you all for joining. I hope to see you at our future CHWC events, including our June quarterly, which I think this might come up again in the June quarterly because I think it pertains. So thanks, everyone. Happy spring.
Thank you. Bye.
Tess, thank you, Erin.
Thank you.
Bye.